We often assume that medical errors will happen in a clinical setting. However, non-clinical errors can also cause patient harm. One example occurred in Durham, North Carolina, causing the Duke University Health System to write a letter to patients who recently had surgery, informing them of a medical error that affected around 3,800 patients. The letters were sent out on January 6, 2005, but to understand how a non-clinical error could affect such a large number of patients, we need to go back to the summer of 2004, when contractors came in to fix an elevator at one of the hospitals. They needed a container to drain hydraulic fluid from the elevators and found empty barrels on the back loading dock. While the barrels may have been empty, they still had a label on them for surgical instrument detergent. The contractors filled up the barrels with hydraulic fluid and then returned them to the back loading dock for disposal, leaving the labels intact. A short time later, a supply company came to pick up the empty barrels of surgical instrument detergent. Upon arrival, they discovered that the barrels were actually filled, and because hydraulic fluid and surgical instrument detergent are almost identical in color, they assumed they were picking the barrels up to be returned to the company. The barrels were then redistributed to other hospitals within the health system. By the fall of 2004, surgical instruments were unknowingly being washed in hydraulic fluid, and surgical teams began using those instruments on patients in early November. While many employees on the surgical teams noticed that the instruments felt slicker than normal, no one spoke up until the end of December, when somebody finally said, "Something is off, we need to stop the line." By that point, 3,800 patients had been operated on, with what they would discover on December 29th, the instruments washed in hydraulic fluid, and they quickly alerted the president of the Duke University Health System of the medical error, which takes us back to the letters being sent out to patients. After further investigation, they discovered that no patients were harmed in the medical error. However, as we go back through this timeline, you'll notice a number of times when someone could have spoken up with a concern or a question and possibly prevented patients from having to receive a letter that they were part of a medical error.